day, dear viewers. On behalf of Moja Ramesh Amitis Health Tourism Company, I'm here with you to introduce to you another one of our medical treatments that we offer to foreign patients in Iran. I'm going to briefly introduce a weight loss procedure which is called Intragastric Balloon placement, which involves insertion of a saline-filled silicone balloon into your stomach. It helps with weight loss by limiting how much you can eat, so you can feel fuller faster. How it works is that it increases the time it takes to empty the stomach, and another reason it helps is it controls the level of hormones that control appetite. These procedures, one of which is gastric balloon, is recommended to people who are concerned about their weight and for whom exercise and diets have not worked sufficiently. It is a procedure that needs to be determined beneficial for you by your doctor. What is important to know that these weight loss procedures, one of which is intragastric balloon, is suited for people who are willing to change their lifestyle to a healthier diet, to commitment to long-term exercise, and on the whole, healthier lifestyle habits. And they usually need behavioral therapy to guarantee the positive outcomes of this surgery. The surgery is recommended for people whose BMI or body mass index is between 30 to 40, and again, it needs to be determined by your surgeon if you're a good candidate or not. As a weight loss procedure, gastric balloon, like other procedures, can help reduce the potential risks that are associated with obesity and being overweight, such as hypertension, high cholesterol, heart disease, and obstructive sleep apnea, and gastroesophageal reflux disease, and non-alcoholic fatty liver, or non-alcoholic steatohepatitis, and joint pain. I'm sorry. There, like any other surgery or procedure, there are risks associated with this procedure, among which are pain in the stomach area, vomiting and nausea, which are normal for a few days after the surgery and can be managed by pain controls. But if they persist, which rarely occurs, you need to consult your doctor. Another risk with this procedure is the deflation of the balloon, which causes the balloon to move through your digestive system and cause blockage, which requires another surgery or procedure to remove it. Another risk may be overinflation of the balloon, or acute pancreatitis, ulcers, and holes in the stomach wall, or as they call it, perforation of the stomach wall, which again need medical interference. How you prepare for this procedure is that you will be consulted with your surgeon and a nutrition team You will be instructed to balance your diet in the days leading up to the surgery, and you may be recommended to start physical activities and balancing the medications you already take. And you need to consult with your doctor if you have already had surgery on the stomach or other weight loss procedures done on you, which prohibits you from this procedure. And what happens during the surgery? This procedure is considered an outpatient procedure, and it will be done under sedation. The doctor will insert a tube into your stomach, or as we call it, the catheter, and then insert the intragastric balloon into your stomach. He or she then inserts another flexible tube that has attached to it a camera, or as we call it, an endoscope, which makes it easy for the doctor to see the procedure as he or she fills the balloon with the saline solution. This surgery it takes about half an hour, and after the surgery, 1 to 2 hours after the procedure, you're allowed to go home. What matters here is your diet after this procedure. For the 6 hours after the procedure, you can start having food, but for the first week, you need to follow a clear liquid diet. And at the start of the second week, you can go on to soft foods, and in the third week, you may, if recommended by your doctor, you may proceed to regular food. The gastric balloon usually is set in place for 6 months, and after that this time it is usually either removed based on the plan that your doctor has devised for you, or it will be replaced by a new balloon to continue the process of weight loss. During this time, you need to commit to a healthy diet, which is very important, and physical activity and exercise, and usually, if you need to, consulting psychologists in this matter. You will need behavioral therapy to be able to stick to this weight loss plan. How much you lose weight depends on how committed you are to your healthy lifestyle habits that are instructed by your doctor, and the exercise that you stick to. And it is generally reported that in the first 6 months after this procedure, usually a weight loss of about 7 to 15% occurs, depending on your individual progress. And the excess weight loss is about, after the 6 months, is about 30 to 47% of the weight loss. This procedure, no matter how correctly it's done, it does not always guarantee weight loss. Most importantly, if you do not stick to a healthy lifestyle and commitment to changes in your lifestyle of diet and exercise in the long run. There may occur gaining weight, which again comes back to your commitment. So it is a factor that before the surgery you need to consider fully and to have realistic expectations of this procedure. I think I've covered the whole process for you, and we come down to the this procedure, the conditions of this procedure in Iran. As you know, Iran is among the top countries for medical tourism in terms of the quality of healthcare and medical care that it provides for the patients and the costs of these treatments. In what we offer to you as Moja Aramesh Amitis Health Tourism Company are 3 packages. The bronze package does not include accommodation, but it covers the entire medical process and the provision of a translator or interpreter, medical expenses, transfer, and the package starts from $1,950. The silver package, which includes 5-night stay in a 3-star hotel with the same quality of the medical care, and it starts from $2,100, and there is a golden package which includes a 5-night stay in a 5-star hotel that starts from $2,200. That's about it about this procedure of intragastric balloon placement. And if you have any questions or concerns about this procedure, please contact us through our social media channels like Instagram, Facebook, our website, amitismedtour.com, and our WhatsApp numbers, and we will get back to you ASAP. And that's it. Thank you for your time and patience with me, and have a good day.